For those of you who do not know me, I am the CEO and the owner of Pain Care, which is the largest pain management business in New Hampshire, and probably New England, that's a guess. As you can tell from my speech, I have an impediment, and I think it's germane to actually discuss it a bit. I haven't always had it. I wasn't born with it. I'm an extreme sporter. I was into extreme sports before they became popularized. I was a skier for many years and did what we call forest skiing. They now call glade skiing. And I've done a few sunny bonos with a couple of trees in my day. About 6 years ago, I decided to convert to snowboarding, and I couldn't just snowboard. I had to learn to jump and do flips. And I was practicing a 360 vertical flip about 3 years ago. And as I was coming off the jump and looking down to my landing spot, I realized there was a red flash of a parker, what we used to call parkers, down below me. And of course, it was a skier. I learned later it was a skier who was snowplowing, was off course, was in the terrain park area where he didn't really belong. But in any case, I apparently crashed into his right shoulder. It didn't injure him, but I landed on my head. And 2 hours later, I woke up with obviously a concussion. The CT scan had been done, and I had a small, about a quarter-sized hemorrhagic lesion in the putamen, which is a nucleus within the cerebral cortex. And it actually provides coordination of the muscles to the face. So I woke up talking like Donald Duck. And it was all from this tiny hemorrhagic traumatic lesion. In any case, the reason I'm bringing it up is not to generate any sympathies from many of you. I'm fine. I still snowboard and I still do flips. In fact, I've taken up rock climbing, so I'm crazy. But the issue is that if I were to take that MRI, I subsequently had an MRI with contrast, and it showed this hemorrhagic lesion very, very well. You could hold it up. Anybody in the room who has never seen an MRI, put it on film and put it on a view box and take a look at it, and you'd see a perfectly symmetrical brain with the appropriate sulci that called and no atrophy. It would look to you normal and symmetrical. And then zap, right there is a little hole, an area where I had this stroke. You'd know something was wrong. And if you looked at me and you could see that, well, it's kind of a problem around this mouth. You put the two together, and then if I were devious, I might present to this individual, let's assume it's a practitioner, you know, I get a lot of pain because the muscles are tight, and at the end of the day, it's driving me crazy. I can't sleep, you know, blah, 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 blah. How can you not prove, how can you disprove that I'm having pain in my jaw from that lesion? You can't. We don't have what's called a pain gram. I think maybe in another 10 years we'll have fancy PET scans that will actually help us out in determining who has pain and who's just simply wishing to satisfy a craving. But we don't have that now. What we do have, for instance, at the pain clinic, is certain tests like urine tox screenings, which I feel horrible that we have to subject bona fide pain patients to. It makes them feel like criminals, like we feel they're addicts when we don't. We simply have to protect ourselves and protect our community, because a lot of people have a lot of pathology, and it doesn't always cause pain. Not to belabor the point of me, but because of my extreme sporting background, if you looked at my MRI of my spine, you would also be able to say, man, he's got a lot of problems there too. He's got discs that don't, you know, they aren't there anymore. They must be causing pain. Well, I haven't had back pain ever. So some people get paid and some don't. It makes our jobs very, very difficult. So we depend a lot on history, on other reports from other physician offices, on the MRIs, and also the behavior of the patient, whether they comply with our regimens, whether they immediately wish to not try injections, not of pain medicines, but other types of injections, anti-inflammatories, whether they try to avoid physical therapy and weight loss, which can be of tremendous value to pain patients. We put that all together to try to ascertain whether we have a bona fide pain patient or we have what amounts to a diverter. Diversion is our nemesis. And for those of you who don't know what I'm referring to the patient who does exactly what I was talking about, shops their MRI, shops their pathology. And they can, in a single day, visit perhaps several different physician offices and get potent medications for their pain. And then next month, shop different offices. And again, holding the same MRI or CT or whatever objectifiable evidence of pathology that they can. This is where we are. We're lacking a vital tool. And in my mind, the most vital tool we're lacking is a prescription drug monitoring program. And I know that's a program that is viewed by many in the state of New Hampshire, the state that I grew up in. I was born in Frisbee in Rochester. We are clearly, we are clearly at a point where we need to have an ability to get online and determine whether that patient that we are seeing in the office has not tapped other physician offices for medications to put an end to diversion. So we understand that there is legislation that is out there and hopefully will work its way through and be enacted and actually put to use and allow us to join the other 48 states in this country who actually have the same legislation. I'll finish up here real quickly. I'd like to extend a tremendous thanks to the entities that actually contributed to this summit here this morning. And they are, in addition to Pain Care, which is our own nonprofit organization, a wing of People Care, which is a nonprofit wing of Pain Care. We also have other entities. I'd like to thank One Voice for Southeastern New Hampshire, represented by Lisa. Dover Youth to Youth, represented by Vicki Hebert. Bridging the Gaps, the Rochester Community Coalition for Alcohol and Drug Prevention, represented by Jenny Sayre O'Connell, who, by the way, is not relevant. And lastly, I'd like to thank Bob Pease, of course, who is my employee, has been with us for about a year, has done just a fabulous job networking with many of you and many of the folks on the panel.